Hi everyone, I am Dr. Ramesh from Cessna Lifeline Veterinary Hospital. Today we have a Shih Tzu who has got very small stenotic nares and we are rectifying. So what I am doing in all these cases, I am just putting a little bit of local anesthetic lignocaine and a little bit of adrenaline I am adding in that, and I am just injecting inside so that I don't get any bleeding and all in this. Just I am injecting. You can just give a little anesthesia. Doc is reacting. 0.2 ml. Yeah, 0.4 ml. You can give it. Okay. So we are using punch in this case. We are not cutting the edges. We are using a punch of 3 mm. So I am just showing how the punch can help easily to do these kind of procedures. So I am just demarcating and I am just going inside. I am trying to make, I am trying not to go inside the inner area of the mucosa, and I am just going inside like this much, and I am removing this whole piece like this. Can I get a sponge? And you can see that there is no bleeding and all. There is no bleeding at all during this procedure now. Again I am just holding from other side, and again I am just doing this. I am repeating the same procedure. I am just making sure that I am just putting it on the place where exactly, and it should not go my inner mucosa and all. I am just trying to see where I am not going in the inner mucosa anywhere. So fully I go on inside, and I'm just cutting this again from this side. If I'm getting little extra bleeding and all, then usually what I do, I put a sponge inside for some time. But in this case it looks okay. 50 suture material, PDS. So I'm using 50 PDS to suture. So what I'm going to do, I'm going to just pull it like this, so that the pull effect should be in this way, and this side also this way, so that I get a proper symmetrical opening in this.
Smell it. First floor. Tell it.
Is breathing all fine? Sometime I do these procedures with after removing a wedge resection. Sometime I do this. This is more easier if somebody is starting from initial stage. This is the best way to start. Only thing you need these biopsy punches, and you can still do a good job. I have seen sometimes it's causing lots of bleeding and all, and this is quite messy area sometimes, but in this case if you'll see, there is no blood at all coming, and it's very clean surgery, and I haven't done too much of mopping also. Still there is no blood at all, and this effect is because I injected with an insulin syringe, local anesthetic as well as our adrenaline to constrict the blood vessels in this area. So when I am tightening the other side, I will just try to see whether the openings are looking same way. So opening looking same way, so I am just going to do this, tighten this. So you can see the openings are very symmetrical, and This dog looks like it's completely changed from what it was there before and now. It's completely has changed, and in 5-10 minutes you can make this happen also very well without much problem, and they do well. They recovers well. Sometime I have seen they get little bit of depigmentation in this area, which eventually goes. So we don't have to do anything for the pigmentation during the healing process. That happens because they keep licking this area, and that's what causes the pigmentation in some cases. So that's all about this kind of procedure. You see that all fine. Some of the hairs has come inside, so that's why it looks a little weird from this area, but it's quite symmetrical. Completely opened up nostril. That's all about this. Thank you.